Greetings, everyone, and welcome to our very first product launch that is online. Thank you very much for embracing technology and allowing us to bring this to you in this particular way and platform. As you can see, we are here in studio, and you're clearly not stuck in traffic. I know so many of the teams have really went all out, hired boardrooms, made sure that everyone can, of course, get to watch all at the same time. So this is being broadcasted all around the country, and it is certainly quite exciting to see that everyone has really taken this quite seriously and made sure to make an effort with it as well. So just to get you familiar with how we're going to be doing things, there's a question and answer that will be able to take place, and you can, of course, give us your comments and questions on the chat box provided. So just check that out and give us them there. You can also send us your questions or comments on qa@unityhealth.co.za. So we'll be definitely looking forward to hearing what you have to say or hearing some of your questions as well. Now, if we don't get to answer all your questions today, don't despair, because we'll be able to answer them in a podcast series in the run-up to 2020. So I've got here some knowledgeable panelists. They represent with them in totality about 50 years of experience within this healthcare industry. So it's going to be quite exciting to hear what they have to say. But before I introduce them, I also need to tell you that if you're watching right now, then congratulations, because there's a big chance that you might just win R1,000 Take a Lot voucher. So we're going to be announcing those winners, of course, as the time goes. And I think that announcement will also be happening on that chat box platform. So do indeed engage, and you might just see yourself as a winner, because I got a team behind the scenes who'll be checking out who those comments and questions are coming from, and they will be picking a winner from that as well. So let me introduce my panelist right here. To my left-hand side, I got a gentleman who is so in tune with the inner zing, or the chi, whatever it's called. It's something to do with meditation. Now, he meditates about 1 hour and 30 minutes every single day. Is that true, Vernon?
Yeah, absolutely.
Absolutely impressive. So, Vernon, tell us a bit about how you got into the healthcare industry.
Yeah, thank you, Ezra. Thank you. Very excited to be here. So thank you very much. It started a long time ago. I've largely been in the health insurance industry. So I'm an actuary by qualification, and started working way back in health insurance in those days in the medical scheme environment. In the early 90s, and went through the whole change in terms of the new legislation that was released in 1998, that came into effect in the year 2000, where there was community rating, open enrollment, etc. So it's been a long road, and it's kind of evolved over time, and now focusing on primary healthcare insurance. So very excited to be in the sector, and I think we're doing a lot of work for people that aren't able to afford medical aid, and providing them something that's more affordable to them, and that actually provides for their essential needs, essential healthcare needs.
Excellent. Well, thank you very much for joining us, Vernon. And then to my right-hand side, I've got Xhosa speaking, Liverpool supporting Afrikaner. How are you doing, Tosca?
It's dangerous to say Xhosa speaking. I won't go that far. With my one sentence.
Yeah.
I'm doing it well, and you, is it?
Fantastic.
Yes.
So how did you get into the healthcare industry?
It was a long time ago, and in the Eastern Cape is really where I earned my stripes in healthcare. It was really the environment that Vernon just described. Employers could be experience rated based on their own claims. It was a volatile time. 3 medical schemes were liquidated. It was a time where we focused on HIV programs, even internationally. So it was an exciting time in healthcare, and today it still is. So I love the industry.
Excellent stuff. And thank you very much for joining us.
Thank you.
Great. And I've got Arnold as well. Now, Arnold, you are in enduro motorcycle racing every day on the weekends.
On the weekends, yes.
Wow. Is that what the beard's for, right?
Yeah, just keeps
I'm developing mine. We'll join each other soon.
Awesome.
So what are you looking forward to throughout our discussion today?
Well, I'll be talking about our client base and what Unity Health means to them, and then also just about the future, 2020. And that's something that we're looking forward to. I think we're going to have a great year for next year.
Excellent. Thank you very much. And then I've got Michael, 17 handicap on the golf course. There's a Tiger Woods and you're a Lion Woods.
Even better. Even better.
Excellent stuff indeed. So, Michael, tell us a bit about what you're looking forward to today, and also just a little bit about how you got into the industry.
So, not many people know the real story. My parents always wanted me to be a doctor, but I never listened, and I ended up studying a commercial degree and business degree, and happened to luck into the medical environment about 15 years ago. So, and since then, I've enjoyed every day of it.
Wow.
Obviously, for 2020, we're looking forward to find to bring our brokers updated in terms of the tools that we're going to be offering them and the new product information. So that's why we're here today.
Excellent stuff. So, I mean, let's just get straight into the thick of things and let's understand exactly what we can look forward to in 2020. Arnold, I'm going to start with you. What's keeping brokers up at night?
There's a couple of questions that they have, especially in the medical insurance side, is obviously NHI. So that's going to be a big topic of discussion we're going to have today as well. And I think on top of that is the economy of South Africa. So for their futures, where's the growth going to come from? And I think Unity Health is providing them a huge opportunity to grow. The brokers are also very worried about massive increases in premiums, so we need to make sure that that's okay. And they want to know that our network providers are strong and that we're paying them correctly, which we do. And then they also they worry about the tests that they have to do because they can get quite stringent and it takes up a lot of their time. So we're just there to discuss about that as well.
Now, you're mentioning quite a lot of things that they would be rightly worried about. Tosca, this is why I want to rope you in on this conversation. Could you please paint us a picture of the health industry landscape and what key aspects really impact the brokers directly?
Sure, Reza, that's such a loaded question in that so much is happening and really as we speak. I think we need to appreciate that brokers are duly regulated. So with the FSCA, the Financial Sector Conduct Authority, as well as the Council for Medical Schemes. And what that means is really some fancy footwork required from the brokers. In that, if we look at 2017, more or less, is when Twin Peaks started being rolled out in South Africa. And with that, brokers have to change and amend their strategies as they go along, really. We've seen the treating customers fairly framework from that. We saw the policyholder protection rules. And for brokers, it really means that they need to decide where they want to be in terms of, for example, the retail distribution review. Do they want to be a tied agent? Do they want to be an independent advisor? In terms of the policyholder protection rules, I'm just thinking of Rule 13, where there's a requirement, quite a heavy requirement on brokers if they do any of the binder functions. So that's a decision for the broker to make. Do I want to have that technological investment to perform those type of functions? So for the brokers, it's really a difficult industry. Also, if we look at the recently published health market inquiry recommendations, now we will get to NHI later, but the health market inquiry recommendations really pertain to the private sector. So it's really an overall of the private sector, and really every area in the private sector has been covered in the recommendations. We look at the funders. They're concerned also about the oligopoly in terms of certain hospital networks, also in terms of a basic benefit package coupled with a supplementary package for the whole industry. A few years ago, there was a lot of talk on a risk equalization fund. That concept is brought back into the recommendations of the HMI, but it's called a risk adjustment mechanism. And all schemes need to, it's really just to cross-subsidize the risk pools between schemes. And then in addition to that, there's also mention of brokers. Your question specifically pertains to brokers. So there's also a mention made of brokers to opt in or opt out. That is in line with the Medical Schemes Amendment Bill that we've seen, where it speaks about commercial value of the broker. So for brokers, it's a few hurdles, but I do believe that the technically sound brokers, and certainly the prudent brokers, would survive this easily. I do think it will all balance to a place of sanity soon.
Yeah. Okay. Well, I mean, there's a lot of different changes in legislation and also in regulation. And Vernon, I just want to put you in here, and I want to hear from you. What do you think these changes? How do you think they impact Unity Health?
Yeah, thank you. I think the health insurance environment has always been a very dynamic environment. There's always been a lot of changes. There's been a lot of changes in terms of medical advancements, the regulatory changes, technological changes, and that obviously impacts the way the product evolves over time. Change, we all used to change in the health insurance environment, so it's nothing new to us. And I think we just need to embrace that change, and it will create opportunities going forward. One of the biggest changes, of course, is NHI.
Yeah, NHI. I mean, that's a big elephant in the room. A lot of people talking about that, quite a lot of debates and so on. Tell me, how do you think NHI will impact the entire sector?
Yeah, I think NHI has largely been driven by national government, and the key focus there is to bridge that gap between those that have private health insurance and those that don't have. There's only about 15% of the population on medical aid currently. So there's a massive 85% of the population that doesn't have any private health insurance. So I think it's important, there's certainly going to be some challenges. So it's taken us quite some time to develop the operational efficiencies and structures, etc., to manage Unity Health members as efficiently as we do. So I think, NHI is certainly not going to be implemented overnight. But I think it's very important that we recognize that it should be there. It's not an industry initiative, it's a country initiative for the whole of the South African population, and particularly for those that are most vulnerable in our society. So I think it needs to be embraced by everybody, that it's necessary. But in terms of being successful, we need to have a step-by-step process, project for project, and it could take as much as 20 years to probably implement if you do it properly. So we don't want to try and do everything at once and it falls over and everyone says, you see, NHI doesn't work. We actually should embrace it step by step and take our time to make sure everything works properly.
Excellent. Vernon mentioned some really amazing points right there. Tosca, I just want to bring you in there, and I'd like to see what further insights you could give us.
Yeah, I agree with you. I think we all want universal healthcare, and we have some question marks around what it's going to look like and the funding of it and the skills and the resources and so forth. But I just want to come back to primary care in terms of the NHI bill. And I think if we look at the bill, it speaks to doctors that will have to adhere to a pricing regimen. And the memorandum to the bill speaks to bringing private healthcare doctors in to make healthcare more accessible. Now that is quite a key part of NHI because NHI's basis is primary healthcare. And what we have seen is that if we look at the report recently released by Genesis Analytics, they led a consortium of PwC and Insight Consultants and Actuaries. And in this report, they reviewed the pilot studies that started, I think it was 5 years ago or so. And in this report, one of the challenges mentioned, now I think we first need to state there are a number of positive things that came from the pilots and the pilot studies. But the one challenge that they mentioned is that only 350 doctors signed up in 5 years. And I think that will be a challenge for NHI. So that's critical for NHI to work, and the doctors need to be brought in as part of the solution. And that, I believe, would help with the solid NHI, and that the private care doctors or private healthcare practitioners form part of the solution.
Great. Now, Vernon mentioned that, NHI might still be a long way off. We talk about 20 years here. more or less. But maybe with good public and private sector participation, this might just be one of those great opportunities for, just being able to adapt in an ever-changing world and just creating something out of that. What can primary healthcare be, or how, in fact, can it be enhanced under the current dispensation? And what is the industry view?
Look, I think the industry view on primary healthcare is that I think it can be enhanced through regulatory certainty. I think it will help if we have clearer boundaries for primary healthcare. We are in an exemption framework, and that helps significantly. But I think for brokers to sell it, it will help to know where is primary care going to fit in with MHI, where is primary care going to fit in with the HMI recommendations and so forth. So I think that will help.
And yourself, Vernon, what do you think? Regulatory clarity, do you think that will help?
That always helps, I think regulatory clarity helps brokers service their members better and their clients better. And it helps with the development of the product, going forward. So I think in the current framework, the current exemption framework is fine. It helps us to offer what we need to offer to membership. And they're quite clear. The CMS is quite clear as to what the requirements are, and they're quite accommodating in terms of allowing exemption if you meet those requirements.
Excellent. Now, what about the economy? I mean, the economy changes quite a lot here in South Africa. And what are some of the changes we see in the economy, and how do they impact primary healthcare?
Look, if I look at the economy and we look at the documents that are publicly available, Stats South Africa states that the average salary of a person that's formally employed is 21,190 rand per month. The Council for Medical Schemes in their report states that the average contribution to a medical scheme is 3,700 rand per month. Coupled with that, we have Business Insider reflecting the number of job losses, over 13,000 now year to date, of those that are disclosed. So this means that for the healthcare industry, people either drop out or they buy down, look for top-up and so forth, but they look at the healthcare spend and they look for more cost-effective solutions in healthcare.
I think that would make sense. I mean, when the job losses are starting to increase, you would think that some other parts of a person's spend would have to start being the areas that would suffer. Arnold, I'll actually just rope you in here. What do you think this is doing? Is it negatively influencing or impacting the Unity Health?
Quite the opposite, Weza. I think the brokers are seeing a huge opportunity here for people to get an amazingly quality product for great value, and they're able to then access doctors and dentists and optometrists at great pricing. So by using Unity Health, they're able to look after their health a lot better. I think the biggest problem is a culture of non-payment, and that's going to be our biggest stumbling block in the future.
A culture of non-payment. Is this an industry-wide problem, Tosca? I'd like to hear your opinion on this, and what can be done to change it?
I think this is where the brokers really help tremendously. Firstly, I think often there's a view that primary healthcare is cheap and nasty, and it's not. There are some primary healthcare offerings, like, for example, Unity Health, where the administration platform, the managed care tools, and so forth are really, really slick. But we do need the brokers to help us with the view and also with education. We need that.
You agree?
Yeah, we found that teaching our target market to use the product correctly has had a huge success. We go out and we train our members what they can and cannot do, what they can and cannot get, which makes them understand the product so much better. By understanding it better, they get a greater value from it, and I found that has been a much better way of lowering rates of non-payment.
Now, Vernon, efficiencies and affordability have been mentioned quite a lot. I mean, I just heard just now from Arnold how the brokers are also worried about, price increases. What does Unity Health cost?
Well, the price increases for next year are about 7 to 8% across the board. And just to give you an idea in terms of pricing for next year, for our most comprehensive plan, so that's primary healthcare and hospitalization benefits, for a principal member, it will be 470 Rand a month. And for a spouse, if you include a spouse, it will be just over 800 Rand a month.
Wow, that's actually really impressive. I mean, geez, I know how much I'm paying. So, Michael, I'm sure you'll organize, right? I mean,
Absolutely.
Great, you see, pays to know some people. Great. So now, here's the next question. What is going to be happening to the Unity Health benefits for 2020?
Certainly. So we've got some exciting enhancements for next year. So we'll be including nursing benefits across the board, and that will just help us increase the access to membership to private healthcare. We're also going to be including specialist benefits. So I think it's important to have specialist benefits in place. That helps a member when the GP is really struggling to treat the patient, and having them be referred to a specialist for treatment. We're also going to be removing the overall annual limits for acute medications and dentistry. We're also removing the overall annual limit for hospitalization and emergency care benefits. And the other where we do have limits, and sometimes limits are important to have in place just to manage the benefits and utilization. So where we do have limits in place, those are going to increase just in line with CPI. And a key focus for us is our wellness benefits. That helps us with early detection of illnesses and diseases. And so we're going to be enhancing those benefits even further for next year. So we're going to be including TB rapid tests. That will be there's going to be a TB questionnaire so we can identify high-risk individuals and then do the TB rapid test if necessary. PSA screening for men over 50, breast light screening for women, and we're also going to be doing optometry tests.
Wow, it sounds like quite a mouthful. Michael, are there any tools available for the Unity Health brokers to understand these changes?
Yes, Weza. We've launched our new website, and after the launch of our products, which is today, we will make these brochures and information packs available for the brokers to download. And then, as Arnold mentioned earlier on, product training is important for us. We have online product test, which familiarizes the brokers with the changes for 2020. That will help with the brokers. And then, but bear in mind, most important part is that the brokers need to be compliant when they go to market. And so we will obviously assist them in getting into that space.
Now, let's talk about that space and just that process that is usually required for a broker to really get compliant and understand everything and so on. How is Unity making it easier for this transition to happen?
Well, all the brokerages know that compliance remains their ultimate responsibility, but obviously Unity Health will facilitate the discussions with the insurer about the intermediary contract and get that in place. And then most important is to make sure that the product training takes place so that the representatives are able to go and market the product correctly.
Great. Arnold, I just want to rope you in here. Can you just walk us through the process?
So it's quite a simple process. Once the broker's shown interest in marketing Unity Health, he will then complete a Constantia agreement, which is just your usual documentation to prove that you are a compliant brokerage. They will then receive a broker code. Once they've received that, the BCs will go out and train them. They'll get comprehensive training on the product and frequently asked questions. Once the training's completed, they can do the online test, as Michael spoke about, which is very simple. It's 30 questions. It's an hour. So it's very, very simple, very easy just to understand. There's very few grey areas in our product, so it's not a confusing test. So it's quite important that the guys get it done. And then, they can go out and market from there. It's as simple as that. Yeah.
Quite simple, as you put it.
Yeah.
So, the most important thing for any broker is to make sure that they can provide the best service to their clients. How does Unity help with that process even further?
Sure, Weza. I mean, one of the things that we'd like to do going forward is to help the brokers put forward proposals to their clients. We understand our product better than the other parties in the market, and for us to put a tailor-made proposal on the table for the broker to put forward to his client is certainly going to add value to the conversation. In addition to that, we're also able to look at special pricing considerations. Obviously, that would have to be signed off by our underwriting team, but we do think that that can also add value to the brokers going forward.
Excellent. Yeah.
And then going forward, in product comparisons, we're happy to do product comparisons. We believe our product stands up favorably against our competitors, and obviously that does help the broker align himself with understanding what the product can offer to his clients.
Great. Well covered. Now, I think we've covered quite well when we look at the brokers and that entire process on compliance and so on. What I want to do now is just have a look at Unity again and look at how Unity is looking to evolve going into 2020 and beyond. Vernon, I think we can ask you on this.
Sure, absolutely. Thank you. I think we're going to continue to improve on our operational risk management efficiencies. It's quite important to focus on utilization abuse and fraud. That helps us to reduce the claims, and it helps us to be competitive going forward, and it helps for a more sustainable product and pricing going forward. And that's exactly what the brokers were concerned about, which Arnold mentioned earlier on. I think the other key element is that we need to focus on is the disease management process, and there's quite a process involved with that. So we want to identify members early that might have illnesses and diseases, register them on the chronic program, if necessary, provide them with educational materials, guide them through dietary changes, lifestyle changes, etc. Empower the member. I think it's very important to empower the member so that they can take charge of their own healthcare. And look at compliance. So those members that are taking chronic medication, make sure that they comply every month, taking their medications, etc. We also want to focus on developing our provider network further. We have a great network in place already. We have over 2,700 GP providers in place, and we have a few very capable ladies that are on the road every single day of their lives. So it's hard work, but they go and visit all our providers en route and providing them with all kinds of materials and creating awareness of Unity Health in the market. I think we also, going forward, we also want to develop a rewards program. We've already started looking at that. It's something that we will probably release during the course of next year. But it's just another benefit that we would like to provide to our membership. The other key element I think we're focusing on, and that's something that we have touched on before, this is the technology age. Technology is expanding at a very rapid rate, and you have to embrace it. If you don't do that, you're just going to fall by the wayside. So I think we've embraced it. We have, as many other providers as well, have developed a app for members. Easy for them to access their membership details, claims, look up providers. So there's a lookup function to find out where there's providers close to them. There's a digital membership card. So if they lose their card, they can go to providers and they can show them their card and receive access to benefits. And there's also very importantly a push to call emergency button. So if you're in an emergency, you could and you're registered with the app, then you can just press the button and emergency services will come collect you.
Wow. Yeah. Sounds like the future's looking bright.
Absolutely.
Excellent stuff. I just want to go back to Arnold. Now, when you discuss Unity, whether this is with individual clients, with with employer groups, what is the general feel? Are people excited about the product?
Yes, the individual members are excited. They're getting access to private medical care, which they've never been able to get, and this is really helped them a lot. They're getting medical care. They're getting doctors' visits. They're getting optometry, dental visits. These things are basic necessities. So they're loving that. The groups are also enjoying this. Especially from our wellness program. When a company gets a report on the wellness of its company, they're then able to have a look, see what they need to do to chat with their members and get their health right, so that they can be happy, sustainable workers. Yeah.
Excellent. Yeah. Great. Now, let's go back to the brokers and let's just see how much more we can equip them. Michael, I want to ask you now the following. Is there any marketing advice that you could give the brokers regarding the Unity product?
Thanks, Weza. We obviously align ourselves and we strongly believe in our product that's going to make game-changing outcomes in the primary healthcare world. And so for the broker to align themselves with Unity Health, where we have specific benefits, for example, like unlimited GP visits, this talks to the core of healthcare and the outcomes for members. This type of offer will ensure that members get the service that they need. Obviously, no one really knows when they're going to need to consult a doctor, and we want to make sure that this benefit remains available to our members.
Now, Tosca, would you say that Unity Primary Healthcare Insurance and hospital cover fills the hole that a perfectly running NHI should be filling for us? And if so, is it an essential insurance product in South Africa?
Undoubtedly. And I say that because primary healthcare provides affordable or cost-effective healthcare, and it makes it accessible. So, which is the aim of NHI. So, also it provides good quality cover, supported by sleep admin, good managed care protocols. So overall, really a very comprehensive, cost-effective benefit.
Excellent. We got a couple of questions from our viewers, and of course, apologies again if we couldn't get to all the questions. We're just going to take about 2 of the questions, and then the rest we'll answer in that podcast series. And not only that, but some of them might even be able to reply to you via email as well, to all those that send your questions in via email. But here's a question, maybe the first question, Arnold. We'll try and answer this one. So this is a scenario. So my doctor is not on the network. What do I do?
Oh, it's quite simple. You can contact our networks department and let them know of your doctor's details. We contact the doctor and ask him to join us. If he does join us, then obviously great. We'll have another doctor on the network and everyone will be happy. We can unfortunately not force him to join, as it is his own business. But most of our doctors join, most of the members' doctors join, because they know that it's going to make the member happy. So yeah, it's a simple process. Contact us on our 086 number, ask for the networks department, and they'll contact the doctor for you.
Excellent. We got another question in here by email from Candice. And Vernon, I'll ask you to answer this one for us, please. Re-explain the specialist benefit again.
Yeah, absolutely. Thank you. So the specialist benefit is a benefit that's pre-authorized. So the member and the doctor needs to contact our pre-authorization division to get access to that benefit. And how it will work is that it needs to be after treatment with a doctor has actually failed. So the doctor's had difficulty in treating this patient and needs to refer this patient to a specialist. So it has to also be by referral from the GP.
Excellent. Well, that is all we have time for. Thank you guys so much for joining us in what has been the first and hopefully of many. We'd love to hear your feedback on this format and what you think of it, because it was the first time us trying this out. But I really do think that it was quite successful. And thank you guys for joining us. This was quite well done.
Awesome.
Excellent. So we didn't forget about the competition, of course. What we'll do from here on in is make sure that all those winners are actually announced right there on the chat box. Other than that, the team will then contact everyone individually and arrange for the delivery of those particular prizes to everyone as well. So thank you very much for watching. And of course, if you have any more questions and comments, please make sure that you still send them through. We'll gladly accept them. And if I need to repeat that email address for you again, in case you want to send us something outside of this particular broadcast, it is qa@unityhealth.co.za. So thank you very much from us right here at Unity. It's goodbye from us.